is Dr David Strain, Senior Lecturer, Clinical Lecturer at the University of Exeter and member of the NHS Long COVID Task Force and the British Medical Association's lead on long COVID. David, good evening.
Good evening, Nigel.
Now, I know you listened carefully to what Robert Malone had to say, and he has become very, very sceptical, in fact, almost damning about the Pfizer vaccine. I just wondered how you would respond to that.
I think one of the first things to say is I have a huge amount of respect for Dr. Malone. His groundbreaking work actually led to this mRNA technology that gave us the Moderna and Pfizer vaccine. He was actually one of the people who got it all started, and obviously it's been an incremental bit. However, I do question his current interpretation of those data. Looking at the fact that we are currently much higher infection rates than we were this time last year, but a 5 times lower hospitalization is in part due to Omicron not being as deadly as the Alpha that we had this time last year, but also in no small part to the fact that the vast majority of vulnerable elderly patients and even the younger patients down to the age of 18 are all double vaccinated, many of which are boosted. And that plays a tremendous part in keeping people out of hospital and keeping people healthy. If we look at the patients who are currently in our ITUs and my own practice where I was this morning, all of the patients who are requiring ventilatory support or oxygenation are currently unvaccinated. And we're starting to see a rise in COVID hospitalizations in children and pediatric populations, such that even the risk-benefit ratio looking at vaccinating children versus not vaccinating them is being skewed at the moment.
Okay. David, I get that. So basically, your strong belief is that if you have the vaccine, that you can still catch COVID, but you are much less likely to get ill, yeah?
Absolutely. I mean, I don't think there's any doubt at all from the patients that we see that you can still catch COVID. Double vaccinated patients are getting COVID. Boosted healthcare workers are actually catching COVID, but they're not getting sick and they're able to return to work within 7 days. And we've seen the government change its policy recently to help support that, as opposed to the unvaccinated who are still ending up in hospital. And that's where the vaccine's really playing a part. Now, I do want to highlight something that Dr. Malone said about the vaccine may be associated with an increased risk of catching Omicron, and that's all behavioural. If you're double vaccinated and you're a 20-year-old, you go into a nightclub, you get rid of your mask and you feel you can engage in a way that actually isn't really particularly safe when it comes to spreading the virus. But again, they don't end up sick, and that's the important bit.
Okay, and David, finally, as somebody working, living and breathing medicine, there are constant debates about whether we're using the right treatments, the wrong treatments, the new technologies, and over decades and centuries, our thinking on medicine and on science is constantly changing. And you may respect Robert Malone for the work that he's done over the decades, and clearly you do. You may disagree with his current interpretation of the facts, but surely he should be allowed to argue his point of view.
Absolutely. And actually, I would stand with him that he should be allowed to argue his point of view, because unless we can have fully open debate, it almost perpetuates the myth that this is in some way some conspiracy going on. There needs to be open debate in order to quell those conspiracies and form a scientific consensus.
Absolutely. David Strain, thank you very much indeed for joining us here on GB News, where we always have open debate and we're not frightened of touching any subjects.